Okay, I'm also keeping my eye on time because I am aware that I have got a lot of things to cover. This presentation did have a plan, and it sort of, as I was writing it, kind of expanded and changed. So there's a lot in here. I will be speaking really fast, so sorry. So, you know, coming from a place where I was supported by an exotic practice with an exotic vet, to then going into general practice was quite a shock for me. Not because of any bad reason, but we only know what we know until we don't know better. So general practice was a little bit of an eye-opener for me, and what I wanted to try and convey through this is ultimately things I've come across in the last couple of years that I think it's worth addressing, speaking about, or pointing out to hopefully improve, because show of hands, who's mainly cats and dogs in the room? Shush, Kay. And exactly, so you know, there's a lot of transferable skills we can use that I think it's very easy for people to get in their mind about. I only do dogs and cats, never seen a chameleon in my life. Suddenly there's a chameleon there, and they're not too sure how to approach that. So really just trying to cut through things that we can change in general practice or adapt to, because you don't have a fancy practice with exotic things and you need to DIY a lot of things. A lot of my job is DIYing things. So before we go anywhere, trigger warnings. There will be snakes, spiders, small birds, mammals. Someone will not like at some point some things. Everyone doesn't like a certain thing. I don't have anything too bad, but there will be some surgical procedures. There's sick animal photos, and potentially there's a couple of photos that I wanted to raise points about that are very welfare oriented, welfare issue animals that came in. Yeah, my words are not working. So apologies if no one likes that, but the last trigger warning is the fact that I enjoy unflattering photos. And it's not just me, wait till you see the rest of them. So we carry on. So I've tried to make it as sectioned as possible, and then I've got extras at the end. You're traveling in consults, so your client training is my favorite thing. We do have videos on secure carriers and traveling to practices, which will be on our social media. By all means, use and abuse, share with clients, whatever you need. I'm sick of boxes. I'm sick of taping boxes and holes in boxes and things falling apart and someone carrying in their animal without a carrier or anything like that. So, you know, training your clients initially what is appropriate and the rules of your practice for that. Again, heat for reptiles, hay for herbivores, these should all be common sense, but a lot of clients maybe have never really thought about the approach from our side before. I love Pet Remedy because it covers all species. Obviously, it's not going to change any behavior of your species, because usually prey species are so stressed that by that point they're showing these stress signals. However, Pet Remedy has been shown to sort of reduce the chemical buildup inside as such. So I like it anyway. I've got a little thing in my pouch and I spray myself all the time. Habituation to carriers, really, really handy. And what I mean by that is the same things you do with cats is put the carrier in their favorite place, make it warm, make it inviting, put treats in it every day, maybe not super fatty or super quantities of treats, but allow any pet, birds, reptiles, cats, rabbits, to hop in and out these things so it's not associated with the vet, and then the stress build-up doesn't start when you get out the carrier. A lovely example, don't know if anyone recognizes Dr. Phil, not the TV sensation, but he came in the other day with his guinea pigs to our delight, and he was an absolute star. Guinea pigs have got hay, they are in a secure carrier, he's carrying it securely, they've got a nice soft comfy bottom and cushioning, not bottom myself, so it was just a really nice example. What I don't want to see is boxes and holes, and also yeah, boxes and holes and tape and duct tape. I get really frustrated with anyone that has that. Right, walking through the door of your practice is the first impression anyone will get, and it really does matter, especially for an exotic pet owner, to feel like you're walking into something with a friendly, nice, cute face is perfect. What I found is sometimes, depending on who was on shift, you came into this, and it really breaks the trust of your client when you come in. You've got somebody that is not keen on your exotic pet, which is sad. You want to start with a boom. So the reception is the first thing they see. Making sure your reception team, but also everyone in your team, your VCAs, ACAs, your nursing team, and your vets. I don't care if you don't like the species that you have been presented with. That is not an excuse to turn your nose up or make a face. So being inviting and trusting, equal care to species was absolute something I tried to change in the last couple of years in previous employments. Training if needed to reception. It's understandable I want these things, but actually how am I going to put it across to my team when they don't actually know much about the species that they're coming in to see? They're in charge of the reception. So if you've got a barking dog here and there's a cat sitting next to it, they were very good at actually we've got cat seats around here just because the dog is noisy, let's reduce the stress of the cat. Again, because of the lack of experience, the people would bring in a bird uncovered, sitting next to the cat in the carrier. And these little things, just training and exposure to being like, right, actually, here's the pet remedy covers that we provide, let's put it over the bird. Let's move, there's no cats in the corner at the moment, but there's dogs, let's move the rabbit over to the cat corner. Allowing them to be aware and supporting them to make these decisions and training them that. What do I mean by fake it till you make it? Good question. Everyone was thinking it. As I say, the amount of times this face came across when someone came in with their beloved pet. Ooh, no, I don't like them. Oh, get it away from me. It's not the reception you want, in my opinion, and it doesn't create trust with your client. So it doesn't matter whether it's this. Adorable, yes, beautiful. It could be this. Oh, absolutely stunning. Love it. And it could be some hairless thing that, again, people like hairless animals, some people don't. But again, yes, adorable. And my favorite, my baby, because I did not enjoy the reaction when I started telling them that my pet was being delivered to the practice. And it doesn't matter what species is coming in. If you are coming into disgust, you're not going to trust your practice, you don't want to come back, and ultimately we're there to help the animals. Registration of pets, very important, whether it is for your own practice's records or to also refer as well. Species, breed, age. It seems silly to have to point it out, but I was sick of the last 2 years seeing species, bird, breed, bird. I didn't know what was coming in. I get a call, emergency's coming in, bird, right, great. What is it? I don't know. You didn't ask? No. What age is it? What's wrong with it? I don't know, I just said come straight down. I got really annoyed because, hey, it could be a budgie, it could be a macaw. What am I prepping for? I don't know, and I don't feel prepared for this client coming in. Equally with age, just like I'll give a reptile example. Is it a baby? Is it in fact this thing? Do we have enough people in the practice? Are the people in the practice actually happy handling something as big? I just realized I was standing in front of there, so I'll just move. Age is really important as well, because you could have a young thing, you could have an old thing, you could have big, small, it doesn't matter. Getting your record straight on registration. Now saying that, it's not always the reception staff, it could, or the nursing or whoever's registering it, could be the owners just going, I have a bird. So consults, efficient, successful things that I found would have been helpful but didn't always go down well with the boss, not you, Kevin, other people. So pre-consult information, I fully believe, and it worked really well when it was done, is I made husbandry sheets. So when someone registered at the practice, they were meant to have sent out the appropriate husbandry sheet, which was meant to be filled out by the owner, returned to us for records. Ideally before the consult, but again, you know, slow progress. And that is so helpful, not only just for records, but also the vet who's trying to assess what's wrong. They had 15-minute consults. They don't have time to go through a detailed history of husbandry. And even if they did, some of them just didn't have the experience or knowledge to understand what the answers they were getting. Preparation exam, so helpful. And I am going to be slowly touching on aspects of Monica's presentation and Erica's presentation because it all does combine. Preparation, make sure everything's ready first. Do observations from outside. Get towels. Towels are lovely. No animal, rabbits, like standing on slippy surfaces, or particularly the rubber mats, actually. They're not particularly fond of them either. Towels are really handy. It's comforting. You can use it as an aid if you need to. It's there. Longer exotic consult times was suggested, but apparently they didn't pay enough to warrant longer ones, so that didn't happen. But I do feel there was a lot of younger vets that I've worked with that really would have appreciated a longer consult time. To see their first chameleon in 15 minutes, they just didn't feel prepared, and it was sad for them. Client sheets, handouts, making things for your clients. You've got puppy packs, kitten packs, I'm sure. Why don't make a rabbit pack? They're really not that hard to make. Things about what you can, vaccinations, common diseases. It gets your clients reading about things that they should know. Hutch is not enough, stuff like this. Using handouts as well, saying thank you for coming in, we checked your rabbit, here, go read some stuff at home. Body condition scoring charts, oh my God, they're amazing. And I've got some that Monica had up anyway. We realized last night we've got some same photos, so we're loving sharing, caring. But they are so important. Get them up, get them laminated, put them in the consult rooms, because clients are not aware of these. And actually they see their animal, they touch their animal so much more than we do. They can keep an eye on it if they're aware of it. I will go through what I mean by booper to pooper checks in a bit. And behavioral changes and stuff for prey animals. What I find is clients would come in saying, my guinea pig isn't moving, isn't really coming out of its hide, isn't eating as much. Nothing dramatic, but definitely warning signs. And in the consult, it's about the cat, it's up, making noises, doing all these things because it's prey and it's trying to hide things. So what's happening is the vet is not, or the nurses are not so sure anything's wrong, but they're not listening to the owner, because in their own environment, their own low stress as possible environment, home, they are showing changes. So it's worth listening a little bit more to clients. I know we all have different levels of trust of clients. We get to know which clients we trust or not. But if the client is saying the animal's behavior has changed this week, but it's not showing it in the consult, it's worth taking it a little bit more seriously. This is just an example of a brief snippet of the reptile husbandry sheet we sent out. Now, mine was 2 pages long, and annoyingly, I would ask for specific things and they would come back, yes. It is frustrating. Clients don't quite understand, but you can make whatever one you want, whatever level you're happy with, just to know what was going on. Booper to pooper. Everyone is aware of how to do a clinical exam on a cat and dog. You start at the head, eyes, ears, nose, mouth, going along, checking your fur, and looking through the fur parasites, and looking at the bum as well. There's that end as well. There's so many hidden things in exotics, and again, what I was finding is a slightly less in-depth check for the exotic animals than we were getting for cats and dogs. And what we found when we started, when I started making them do these checks, is you open the mouth of a tortoise and you find things in there. So they weren't looking inside. This tortoise didn't know what was wrong with it, and open their mouth, herpes virus, shocks. On the other side, my friend's not going to like this photo. No one really checked the bum end of things as thoroughly until I got there. And she was appalled about what she found on this penis of a guinea pig. Speaking of guinea pigs' bums, I was also acutely aware when I first started that not everyone was sure where to take a temperature of a guinea pig. So we're going to go through that very quickly. We have this lovely pouch. It's blind-ended, and it fills up, especially in males, with poo, pee. Squeeze it, it all comes out. Smell it before you see it. That is not the butthole. This is not the butthole. That is not the butthole. You can see a poop coming out of the butt. Oh, you can. A little bit. The point is, there's 3 points. And when you open the blind-ended sac area, there's a little nubbin here, down here. And that's where the thermometer goes, because the screaming that I kept hearing from them trying to get a blind-ended sac temperature was sad. So again, these are just things I've noticed maybe common for people that see a lot of them, but anyone that is not seeing as many things, hopefully someone will take something away from it, something in here. Body condition scores, get them up, laminate them. I love these. Rabbit size-o-meter, guinea pig size-o-meter. We've got, again, these things, the amount of fat lizards we were seeing generally. And also, the problem is, owners are not aware of what's a fat gecko either, because they want to feed and love. So if they're aware of it, then they can monitor it as well, all-round health. Nice one for snakes too. Again, I used to put these all up, and I found that even the cat and dog owners were absolutely fascinated by what was going on. Birds, you can have one as well. I'll make a little note just to remind people that sometimes the fitness level of your bird, if there's a lot of flying versus no flying, can impact this one. But again, it's a good starting point to make sure that people are aware, they're keeping an eye on birds too. Just an example of a very skinny one that nobody knew was that skinny. Came in a box, and this happened overnight. Another one that happened overnight is this poor little snake. Again, so skinny, is fine, but was so sort of depleted it couldn't even right itself properly. And again, the owner was lovely, just was not aware that that was not normal. And you can't blame someone for not knowing until they not know it. Well, you can, but you shouldn't. Lovely photo of a beautiful body condition score of a beautiful drinking snake. No. I don't want to see it, and oh Lord, he coming. Okay. Owner's like, it's cute, I love them, look how chunky he is, I feed him everything. No, it's not cute. A 1 out of 5 body condition score is considered abuse, and I'm not too sure everyone feels the same way about the other end, but I do. Nurse consults, please empower your nurses. They are so much more capable than I think they even think. This nurse was terrified of birds, that's why she's laughing nervously. And I made her the little bird beak of fudge, adorable. So this is me just after showing them a couple of times, because this bird came in every 6 weeks. Then I sort of passed on to the other nurses, and this is something nurses are more than capable of doing if they feel comfortable with it. And clients get to pay a little bit cheaper for it. And please spend time with the birds afterwards, or any animal, because you don't want to leave them, go, right, it's done here, bye. Inpatient care, I'm going to speed up again, sorry. We're going through inpatient housing. DIYing housing is absolutely fine. We don't have, not everyone's got specialized enclosures or fancy incubators, but you can make things work. So, not designed for rabbits, but it works. We've got litter tray, we've got hay everywhere, not just in the hide, because you want anywhere the animal goes, you want it to be access to hay. We've got a litter tray designed for using as a toilet, but remember, not all of them will use it as a toilet. This is not dead, it's just sleeping. So yeah, whatever you do, something will use it. This was quite a fun one because it was a mix match of everything. We don't have everything for every single patient. We've got garden slate, aquarium, fish aquarium stuff, got a guinea pig hide. So really just going, what does this animal need? What's the condition they're in? Can they cope with it? And doing your best with what you've got in the practice that you've got, whether it's snuggle safes or you don't have a heat bulb, but you need heat for a reptile. So you've got snuggle safes or warm or hot water bottles if needed, make sure they're covered. Again, you've got a big Tupperware, and you've got a tortoise, towel, some rocks, a dog bowl. Again, just finding what you've got in practice, doing the best you've got with what you have, sorry. And don't worry about ferrets, because they feng shui everything and don't give any hoots at all. They will absolutely rip it apart. But what I find is if you have big blankets, a couple of them, throw them in there. They love rolling about and hiding in them. So it doesn't need to be pretty, but it does need to work with what you've got. This is a cat kennel designed now for chickens. Again, right, ecaniculi, I'm going to just touch on this. Anyone come across an ecaniculi case in practice for rabbits? They're frustrating, crocodile rolling, can't keep themselves up. Again, this is just something we adapted. We've got a little put-up dog puppy crate, padding, lots and lots of padding. There's no bowl of water in there because we all know why. It will roll in it. It will, thank you, my love. Can't shout that much. And speaking about reptiles, this is a Tupperware that has been cut a hole out of, sanded down so it's not rough. These are little humid hides. That's a piece of kitchen roll in there that has been sprayed with water. Helps, as Monica was saying, with shedding humidity. If you've got something coming in and it doesn't like bathing or anything, put a humid hide in. They're really cheap to make, really easy to make, and the reptiles absolutely love them. They just curl up all the time. Catheter care. Jeez, oh. Okay, I'm going to go whizzing through. Catheter care. I'm going to go through things very quickly. Okay, so we've got clip them up because you'll have one that you prefer over the other. Use EMLA, please. Remember, EMLA takes about 30 to 40 minutes rather than the 20 minutes to work because it was tested on new skin that's never seen sunlight. If you don't have that, Inchabees is great, or some places don't like to use expensive Inchabees, and the freeze spray, fine, but don't spray it directly on your animal. While it's cooking with EMLA, prepare things. I use gauze swabs for these to make sure it's the size of the ear. Use gauze swabs. The reason I do that over things like softband is if you pull the middle of softband, it unravels. Flushing your catheter will help because you don't get huge amount of flashbacks in catheter placements all the time with rabbits, but if it is flushed with saline, laws of diffusion, and you'll see that flashback a little bit easier. Straighten raising, we've got this rabbit was a little bit flighty, a little bit nervous, so we did use a little bunny burrito, and we've got an unraised versus a raised vessel. Do assess the catheter size on the raising of the vein. Placement of it. Great photo, Kevin. Thank you so much. Take the bung off. It's extra length that you don't need to fiddle with when you've got a rabbit ear there. Now, you can see I've already, well, you might not, but I've already got flashback, and I've just the tip in there, and I've already got a flashback. It is, you can see when you're in, and thanks. I'm really trying, Kat. But you can see when you're in, okay? And when you are, just advance it a little bit. Put your bung in, get your tape. Now, I don't really care what kind of way you tape in. Everyone's got their fancy ways, their different ways. I don't care. What I struggle with is the type of tape. So using technique over tape is my favorite thing. Use a technique that will hold in a catheter over tape that is stickier, but shite. This thing here, this is the end of your catheter, and what I think I've seen a lot of is when people are taping in, they'll tape this part and leave this open or uncovered, so that the rabbit's grooming as it does, and this really irritating. Who's had a catheter in their hand, they feel the end of it. It's not nice. Cover it with tape, support it, make sure it's covered. Again, I use either micropore or durapore, and I'll go through that later. Little gauze swab in there, really handy. Again, you've all seen this. Bung, flush it quite quickly afterwards because it does clot in there. We don't want to have to do that. Make sure you can feel it flushing. And rabbit proofing. Now, everyone does want to keep it light so that it's not bothering the animal. Keeping it light and uncovered, I mean, the reason we vet wrap things is to keep it clean, but it's also, for me, security as well. Oh, why am I... Okay. I don't know why they're now going here, but okay, we'll do that. So starting at the top, don't worry about going under the bung. Again, we are trying to make it as light as possible. Don't worry about soft band because it's not as needed. When you're wrapping it, though, still go from the tip down to the peripheries. You start from the end, work your way up. What you want to do is make sure this end, ooh, that's so short, is slightly tighter than the top end, because when the rabbit is grooming, it means it can't come off. It genuinely, it will not be able to come off. Keeps it clean. Yeah, you'll have a loppy ear for a bit, that's fine. Keeps it clean, keeps it secure, and it's comfortable for the rabbit. Catheter problems that have bugged me: not the right size thing and not putting it correctly in the ear, and leaving it uncovered causes a problem like this. This tape is the bane of my life, and I don't like it, but that is my personal preferences. It was used because it was stickier, and the technique that they were using wasn't as reliable. So again, I like technique over tape. Other people will have different opinions. The other problem I have with this photo is the fact that its ear is creased. That was what it looks like when you take off that tape, and it's flaky and irritating and red, and we're trying to avoid phlebitis, and it just doesn't really help. That was the ear of the rabbit that had it crinkled. You can see this is a bruise that wasn't covered here, so these are little problems that have occurred, and that's why the little top tips of catheter placements. Okay, other species, please try, practice. You can place catheters in rats. It is possible. If you feel up to it, IO catheters. This inside of a 1 ml syringe is really just to stabilize it. It's a needle, it's not a catheter, it's a blue needle in the bone, stabilized by that and wrapped appropriately. Everyone's got their wrapping technique. That's what it's there for. The middle of the syringe is to stabilize. Bloods, everyone's got species variations. I'm going to go through quickly reptiles because, again, bearded dragons, tail veins, great. Some people do it like a cow. If you're a more large animal, you push it up. Whatever way, whatever floats your boat, doesn't matter. Same goes for snakes, though. They've got a tail vein. Please try and use it. If, for any reason, you can't get the tail vein, there is an alternative. It does need sedation. It's the palatine vein. You can also put catheters in there for long procedures. This is obviously a big snake, so it's more obvious. They are in smaller ones, they're just trickier. But obviously it needs sedation. You don't want to be putting your hand in there. I'm going to briefly touch on my ethical concerns about intracardiac ones, because hands up who's got a dog or cat? Right. Whose dog or cat needed bloods in the past? Right, you've walked it in, can't find any of its leg veins, jugulars, they can't find a jugular for some reason. Would you be comfortable with your vet holding your conscious animal and sticking a needle in its heart? I agree. And why are we not giving considerations to snakes? Because in the past, it was too difficult. They didn't have that many veins. It's too difficult to get any other vein. The problem is they can also move their heart up and down voluntarily, so you've got to hold it in place. It's quite dramatic, in my opinion. And there are now studies and papers they're starting to look into the basically what's being left from multiple cardiocenteses. And I'm not going into that just now because I realize I'm going to run out of time. But my problem with that is, if you need to go to the heart, please sedate the animal first. Rabbits, this is a great hold. So I don't know if you've ever had the seatbelt hold. You're holding the rabbit against you. Your thumb can push out this leg. I'm not a fan of jugulars because I think I saw one that was quite traumatic at one point, and then Kevin showed me another way. This is the CertVNES, and it actually is more prominent than you think. It's slower. You do need to take your time. You do need EMLA. You need patience. But it is more than accessible and a lot bigger, and I'm not jinxing anyone, but it's a lot more accessible than people think. Nutrition and fluids, again, I'm going to whiz through this because I appreciate there's a lot. Okay, floor versus table. I am fully aware that there's definitely different thoughts on this. When I went into the GP practice, everyone was doing rabbit things on the floor because they were so scared. They heard the story of once a rabbit on the table jumped off and broke its spine. I've worked many years with rabbits. I've never had one do that. But then I'm also very aware if I've got a rabbit on the table, I've got towels down, I've closed the door, everyone's aware, they can't come bashing in, they can't, like, a rabbit will get scared, and yeah, it is possible to jump off the table, but there will be a reason for it. What I don't want to happen to, who's seen Guardians of the Galaxy 3? Perfect, who remembers this scene? It's terrifying. And this is a lot of what the prey animals feel, I can imagine, when a little rocket was getting taken out of his cage, okay? It's terrifying, and I didn't like it, and I cried. But it is important to remember that we are huge, and these guys see their world in under half a meter on the ground. So if you are, I can't show you here, I've got a desk, but if you are going down and putting them between your legs as a form of restraining them to feed them, to do that, remember they're very scared, and a lot of times they'll fight you and try and get away, or they freeze and not chew or not do anything. Less can sometimes be more. We all are aware how to syringe feed an animal, but have you tried spending time with them on a table? Or spending time with them, they're not eating their pellets, they've just had a dental, soak the pellets. Find other forms, a way of feeding these animals. Put it in their mouth, then they realize actually it's not too bad. Come down to their level, make sure you're being aware that you are a big monster to them. Try and entice them. They can also eat while getting tubed as well with this. Don't talk about the lettuce, Monica doesn't like it. Wasn't my photo. Yeah, everyone uses different critical care feeds. I love when I have not a difficult animal, one that is maybe not so keen on a certain one, mixing emerald and oxbow, because, ooh, there's my mute. Yeah, if they like it, you don't need to be as imposing. Again, loves the mix of oxbow and emerald, but you can have ones that like oxbow or emerald, doesn't matter what you're doing, just try and find something that works for that animal. This animal will not take it just oxbow, but when you mix it with this, love it. Adorable. You know, if you've got an animal, try and get it to actually, whatever you're doing, just try and work with it. I know we don't always have the time. Again, another guinea pig loves an emerald mix. Pick things from a garden. This owner didn't realize her chickens liked green stuff, and then she did. Reptiles, you can tube them, that's absolutely fine, but see if you've got the time, drip feeding, it's adorable. General anesthesia, what I want to point out is, I know, induction chambers, get ones with scavenging, and okay, main parts, I'm going to flash through. Positioning, please raise the chest of your animals, even if they're small. Don't worry about reptiles because they don't have a diaphragm, but you're going to have to breathe for them anyway during that. Tortoises lie fine that way, but if you turn them upside down, they're a bit wobbly. Use a donut, a little wrapped up towel that creates a donut. Snakes, again, they sort of lie where they're told. Mask tips. If anyone's had to monitor something with a mask and a stethoscope and there's too much going on and it's a tiny animal and they can't write things down because they've got only two hands, loop something through, hook the teeth in it, teeth's my finger, little incisors, and then pull and attach your thing. Your animal will hold, the mask will hold onto your animal without you having to actually hold it, okay? Okay, I'm going to move on from the intubation part because it's not as monitoring. Who's got ECG in their practice? Perfect, use it. Maybe doesn't need to be the pads, it could be the soft clips. Works on rabbits, rats. Here we've got a Doppler. Who's got a Doppler? Right, perfect. We've also got pulse ox. So there's a lot of things that we can use. Right, little catheter to the nose for capnography. You won't get accurate readings, but you will see a wave pattern. You will know when it's breathing. Self-explanatory. Little probe on the side. I was trying to get a bearded dragon photo, couldn't find one. On the side works as well, but also underneath when they're lying flat is fine. I will go past that. It's a Doppler of a heart and a thing. I'm going to pass through a lot of them now because I'm getting evils. Right, one thing I do want to mention is V-gels. I'm aware that everyone has heard of them. You may or may not use them. They are very much marketed for the easy way of intubation. If you're not comfortable with intubation, I very much personally prefer you to use a mask because the amount of times I've seen V-gels placed without capnography attached, which is not the way they're meant to be used. A slight change will then start inflating the stomach, and especially in a crash situation where they think it's quicker, what happens is you end up with a rabbit that you're trying to CPR. You've got a V-gel in, someone's breathing for it, but no one's checked the abdomen that's now this big. Use pain scores, love them. I am going through these as well because, again, they were just extras. Another bugbear of mine, intracloacal administration of Panicure. It goes in here, and then who's been peed on by a tortoise because they got nervous? Everyone, right? They pee it or poop it out, and it doesn't really do much. So try oral, it's much better. Who uses the ringer's hold in birds? The little, yeah, I've been bitten a lot of times with that hold. A very gentle but firm three-fingered hold really does avoid help. Who uses Flamazine and Sudocrem in practice? I love this stuff, really handy. What was not relayed to this client was that it needed to be removed before you reapply it. So this thing came in with several days of layers of cream. Right, this is, sorry, I know, very flashing through this. Flushing wounds with needles that are pointy. If you cut the tip off, means nobody gets stabbed. And if you need to flush close to an animal and it jumps or anything like that, as prey species do, you're not going to harm the animal because it can't touch it. And it means you can get a little bit closer, a little bit handier. DIY is my favorite thing. I made a KY jelly nappy for a prolapse. Things that you can do. Use the transferable skills that you need. And the absolute last thing I'm saying is a hog nose. Please be aware that they have defense mechanisms that may look like they need CPR. So I walked into a situation where they're screaming, please intubate the snake, that had been recovering because it's not breathing. What it was doing was playing dead. So these guys play dead. They look like they are dying. They wriggle, the tongue goes, the mouth goes dark. And I got called down because something was crashing. And then when you open the mouth and the glottis breathes it, you take a second. So please be aware that hognoses play dead. Hognoses also, as a secondary defense mechanism, which the hognose did second time round, bleed out their mouth profusely. There you go, little hognose fun stories. Don't get scared by them, but they are dramatic. Apologies for taking up so much time. Thank you all so much.